Hi everyone, welcome to another episode of Psych Talk. Today I will talk about borderline personality disorder. So, BPD is characterized by intense emotional instability, fluctuating self-image, and very turbulent interpersonal relationships. People with BPD often experience extreme feelings and may struggle with fear of abandonment. They have this black and white thinking, so you're either a good person or a bad person. Like they label the people with like, okay, this person is good, this person is bad, this event is good, this event is bad. There is no gray area. And they are very impulsive. They may engage in self-harming behaviors, and they have suicidal ideations. They lack of a stable internalized sense of self. They have this persistent sense of emptiness or boredom, self-destructive impulsive behavior, such as substance abuse or overspending or binge eating, even promiscuity. They're very irritable, and they may have anxiety with episodes lasting hours to days, intense anger or rage, difficulty controlling temper, and they may have this transient stress-related dissociation or paranoia. And I probably already said this, but they have such an intense fear of abandonment that they usually self-sabotage themselves in relationships because of that. People will usually quote-unquote leave them because of their self-sabotaging behaviors. So they have this intense fear of abandonment leads them to basically engage in this very maladaptive behavior, which then leads people leaving them. So some people with borderline personality disorder can be high functioning and some may be low functioning. It depends always on the insight that they have about their behavior and whether or not they are using a substance, if they have a comorbidity such as depression or anxiety or other personality disorders. And I haven't mentioned this, but BPD is the most frequently diagnosed of any of the personality disorders, and affects 1.6% of the general population. So, a significant aspect of borderline personality disorder is the role of early childhood experiences, particularly attachment disruptions. So, basically, we know based on attachment theory that bonds formed with caregivers in infancy shape emotional and social development. And in many cases, individuals with BPD report traumatic experiences or dysfunctional family dynamics, leading to insecure attachment styles. For instance, approximately 57% of those with BPD have experienced parental loss and may have faced chronic parental illness. Also, maternal behavior, whether overly harsh or permissive, can also play a significant role in shaping emotional responses and identity formation. So, sometimes you may also have a mother who does not show affection or love at all, just showing a very cold behavior towards you and indifference. And then you may have an uninvolved father, and this can lead also to have borderline personality disorder. So people with BPD often experience a cycle of intense emotions and behaviors that can be difficult to navigate. So as I mentioned before, they have this splitting or viewing situations in black and white terms, and it's very common and can lead to problems with interpersonal relationships. And when these individuals perceive rejection, they may experience what's known as borderline rage, resulting in impulsive actions, including self-harm. And what's very alarming is that around 75% of individuals with borderline personality disorder engage in non-suicidal self-injury as a means of coping with overwhelming feelings. So it becomes this coping mechanism. Effective treatment is obviously essential for those with BPD, and there has to be a strong therapeutic alliance. Evidence-based therapies such as DBT, dialectical behavior therapy, have shown significant efficacy. DBT focuses on teaching skills in mindfulness, emotional regulation, and stress tolerance. So, for example, mindfulness involves being fully present in the moment, observing thoughts and feelings without judgment. And this practice helps individuals recognize and accept their emotions instead of reacting impulsively. So, mindfulness techniques may include, obviously, meditation, breathing exercises, and grounding techniques, which enable the client to cultivate awareness of their internal experiences and surroundings without acting their emotions out. And for the stress tolerance, we can teach individuals how to cope with painful situations without resorting to self-harm or other destructive behaviors. We can find a more adaptive behavior to their maladaptive behavior, such as cutting or other self-harming behaviors. And so, for example, techniques can include using distraction, self-soothing, and finding ways to accept difficult emotions. For example, taking a walk, listening to music, or practicing deep breathing exercises. And for emotional regulation skills, we help basically the client understand and manage their intense emotions more effectively, which includes recognizing the triggers, identifying emotional responses to those triggers, and then learning how to respond in healthier ways. And so DBT provides tools for increasing emotional awareness, such as journaling or using emotion wheels to help individuals articulate their feelings. And clients also can learn strategies to decrease emotional vulnerability, such as practicing self-care, maintaining a balanced lifestyle, and developing healthy coping mechanisms. Then we can also teach them interpersonal effectiveness, which basically focuses on enhancing communication and relationship building skills. So individuals with BPD often struggle with interpersonal conflicts, leading to strained relationships. And what DBT teaches is basically it teaches clients how to assert their needs, set boundaries, and navigate social situations more effectively. So techniques may involve role-playing scenarios, practicing assertiveness, and learning to negotiate conflicts while maintaining respect for themselves and others. And so, in conclusion, early childhood experiences and quality of attachments can significantly influence the development of BPD. However, with the right therapeutic approaches, individuals can learn to manage their symptoms and lead fulfilling lives. Obviously, it's very hard to deal with people who have borderline personality disorders, but they can really get better with therapy. So there is hope. And that is it for this episode. Thank you for listening.